and it is my pleasure to introduce our first speaker for this session, Perrine Dhaisne. Perrine is a midwife from Kingston and Richmond NHS Trust who took part in the Green Maternity Challenge, which ran last year. This was a sustainable specialty challenge, which was hosted by CSH in conjunction with some Royal Colleges, such as the Royal Colleges of Midwives. The Olive Clinic was introduced to promote equitable healthcare, prevent poor maternal outcomes, and empower patients. So over to you, Perrine, to tell us about your project.
Thank you. I'm one of the midwives at Kingston and Richmond NHS Trust, and I'm also working now part-time as clinical lead for environmental sustainability. And I supported our safeguarding team in maternity back in 2024 to present this project, the Olive Clinic, as part of the Green Maternity Challenge. And we had the pleasure, obviously, to be selected. So here's a bit more about the Olive Clinic. So as Ayoma said, when we are starting a sustainability quality improvement project, we're always addressing an issue. And really, this was coming from women who had voiced concerns when they attending a focus group in Southwest London in the summer 2023. So that focus group gathered Albanian-speaking women who had experience with maternity services in our area. And when they started to talk about their concerns, they started to talk about difficulties in accessing care, navigating our healthcare pathways. They also mentioned that they had received poor continuity of care. So for those of you who are not familiar with continuity of care in maternity, we always try to have a few midwives looking after pregnant women. So a small team of midwives looking after pregnant women. So they don't see multiple midwives in pregnancy. And ideally, they would see only 2 midwives during their pregnancy to provide them antenatal care. But those women had seen more than 2 midwives. They were also very skeptical about the interpreting services. So what they reported is that they didn't feel very confident that it was of a good quality and that it was confidential. They also mentioned that they would have preferred to have female interpreters. One of the concerns as well was that written information was very difficult to access. And some women, unfortunately, reported quite poor experiences with the maternity services, in the area, Southwest London. So moving on from that, focus group and very keen to do something, we had a look at our data because our safeguarding team has already flagged that we had a significant population of Albanian-speaking women. So having a look at our data, we found out that 1% of our booking were by Albanian-speaking women. And if we compare it with the Albanian-speaking population in the UK, this is 0.2%. So quite significant for our trust. We then had a look at continuity of midwifery care, and only 43% of those women had seen just 1 or 2 midwives during their pregnancy. In terms of English proficiency, 1 in 3 had limited English proficiency. And surprisingly, the use of the interpreting services was then dropping to 19%. So again, that kind of reflected to what had been discussed on this focus group. And also we had noticed, and we knew this was quite a vulnerable population. Obviously, as you could see, we have a language barrier, but we also had women who had socioeconomical issues, mental health issues, and some of them had experienced modern slavery. So a proposal for the Green Maternity Challenge, and I think I remember it kind of ran across like 4 to 6 months maximum, was to set up a pilot for a new clinic, specifically for Albanian-speaking women who were booked in our maternity unit, which is called the Olive Clinic. And in our timeline, we were aiming to set up this clinic with the support of our safeguarding team, so women would have continuity of care. We wanted to involve a female interpreter, which would have attended the appointments. So I've put here in bracket doula. So initially we had a female interpreter who was also a doula. So for those of you who are not familiar with doulas, they are women who have had experience with childbirth and are really keen with supporting women who are pregnant or even after they've had their baby, so new moms. So they're not medically trained, but they're here as a support. So this was really interesting for us because this doula was actually a qualified interpreter and she was an Albanian speaking woman. So that was perfect for our project with the Olive Clinic. And we also had the goal to provide some written information to these women. Then on the long term, we were aiming to set up antenatal classes with the support of the midwives and the doula. And we were hoping to be able to have the doula on call so that she could support the women with birth care. And the picture on the right, actually, that's the room where we are having those appointments with the Olive Clinic. That's the nest in our birth center. So just to step away for a bit from the description of the project, I just wanted to kind of just give you a bit of an overview of why this is a sustainable quality improvement. We're really focusing here on prevention and promoting health and empowering women with looking after themselves and looking after their babies. So if you have a look here on the left, this is what we had before we set up this pilot. We have women saying they are experiencing barrier to accessing timely and appropriate healthcare, and there is strong evidence in the literature to show that this is leading to delayed interventions and poorer outcomes. And as a result, we then have a more reactive approach, which is more intensive and resource heavy. So what we're trying to do here with the Olive Clinic is to provide equitable healthcare and to empower our patients. We know that it will then lead to timely interventions and improve our outcomes, but it will also reduce the need for intensive and resource-heavy treatments. So you will see a bit further, I didn't really go into the details of our project, but if you're using the QR code at the top, you can find the report that we've submitted for the Green Maternity Challenge. So moving back to our pilots from November 2024 to March 2025, we saw 16 women in the clinic. 100% of them had continuity of care with our safeguarding team, so 2 midwives at most. And if you remember, well, that compared to 43% before. We did have a female face-to-face interpreter. Unfortunately, it's not a doula because the doula who we were planning to work with had to disengage with the project quite early, actually, during the setup of the clinic. But we have a very committed interpreter now, and she's still working with us to this date. And as reported, it's a really rewarding clinic. In terms of appointments, we had no cancellation and no missed appointments. And that's something that we had noticed, actually. I didn't put it in the previous data, but we had quite a few missed appointments because of miscommunication and because of the language barrier. We managed to provide written information with the support of the Kingston Interpreting Services. And if you want to have a look at this information, again, you can use the QR code here on the top right. That will take you to our maternity website. And obviously, we faced a few challenges, first losing the doula to start with, but we're, again, amazingly happy with our new interpreter. But then it became a bit more challenging to set up antenatal classes and to obviously offer this additional support whilst women were giving birth. So in terms of the women's feedback, so if you remember well, we had only seen 16 women in that short time frame, and only 9 of them had given birth. So we sent those 9 questionnaires in Albanian. We got 4 answers, and I'm really aware that this is quite, a short cohort. But in terms of continuity, all of them reported this had a very good impact. In terms of interpreting services, they were used by 3 of the women who responded, and 2 were very positive, 1 was positive. And the overall feedback about the service was that it was positive and very positive. And then when we asked this final question to the women, would you recommend the clinic to a pregnant Albanian speaking friend? All of them said yes. I guess on that as well, I didn't talk about the co-benefits, but this was really interesting to notice that our staff was really happy when we came up with this idea for the clinic, because those appointments are really lengthy. For those of you who have had to use the interpreting services, we usually use the phone. We have to wait to be put, on the phone with someone. Again, we're not exactly sure about the translation. Sometimes women do not want to have an interpreter, and then we're a bit stuck as clinicians. So again, this has really had a very positive impact on our team, and the midwives who are running the clinic are also very happy to be able to provide this care. So what happened since we had a bit, you probably noticed, there's a bit of a break between March and September. We struggled a bit with staffing and funding, but we resumed the clinic strongly in September when we secured funding and staffing. Since September 2025, we have seen 19 women in the clinic. So 10 of them so far have given birth. I've had a look at our stats yesterday. 17 of them have had continuity of care, so seeing two midwives at most during their pregnancy, and 19 of them, so all of them, had met with our female interpreter only, and did not use the services, the telephone services at all. So we're really pleased with that. We're now slowly having a look at assessing whether if our midwives could maybe visit the women who are booked and live within our area. So give postnatal visits to those women to again continue that continuity, if I can put it that way. We're collecting women's feedback, so we've had a lot of verbal feedback. Obviously, for these women, it's sometimes a bit more challenging to put feedback in writing, but I have put here on the right a feedback that we have received that was sent to our patient advice and liaison services. And again, this was really endearing for us to read that this woman had taken the time to send feedback about the care that was provided to her. So now our next duty is to do a service evaluation, and we would like to have a good year of provision of the service before we are starting a service evaluation. So just a few more months and then we can start. And I believe that's it for me to present the Olive Clinic. Thank you very much.
Thank you so much, Perrine. If you're happy to stick around for the Q&A, we'd really appreciate it. But a wonderful SusQI project showing how social determinants of health and health inequalities can overlap with your quality improvement project. Lots of claps going up as well.
Thank you very much. Thank you.